Neurodiversity. Ooh. Sounds scary, right? Like it's something to fear. But let's clear up what it doesn't mean. Right? It doesn't mean that you or your child is broken. It doesn't mean there's something wrong with them. And it definitely doesn't mean that they need fixing. What neurodivergence does mean is that your child's brain just processes the world differently. And that uniqueness can be a powerful strength. But it also means that we as caregivers have a critical role to understand them, connect deeply, and keep them safe. Because the truth is, when neurodivergent young people feel unseen or without support, their risk of struggling rises, whether that's anxiety, depression, social withdrawal, or unsafe coping behaviors, including, yes, substance abuse. Now, in fact, youth with ADHD are 2 to 3 times more likely than their peers to develop substance use problems. And among those with both ASD and ADHD, the risk is even higher. I'm Jodie Sweetin, and this is Awkward Conversations, where each week we help parents raise confident, substance-free kids who are ready to make smart choices. So stick around as an amazing panel of experts are going to break down what neurodivergence really is, not a label or a limitation or anything broken, but part of what makes your child who they are. We'll share how to see their strengths, protect their spark, and where to turn for help. Because when a child feels safe, seen, valued, and loved for exactly who they are, they don't just survive, they thrive. Welcome back to Awkward Conversations, and welcome to Season 5. And my lovely co-host, Amy McCarthy, who is a senior clinical social worker at Boston Children's Hospital in the Division of Addiction Medicine. Thank you so much.
Hi, Jodie, and hi, everyone. I'm so glad we're talking about this today because it's a topic that touches so many families. And I'm especially excited because we're joined today by a friend and colleague of mine from the Adolescent Substance Use and Addiction Program at Boston Children's Hospital, Dr. Modar Sukkarieh, or Dr. Mo. He's a pediatrician specializing in both developmental behavioral pediatrics and addiction medicine, and this is his first time joining us on Awkward Conversations. Dr. Mo works with children and families every day to address developmental differences, behavioral health needs, and prevention strategies that help kids thrive. Dr. Mo, welcome to the show.
Thank you so much, Amy. Thank you, everybody, for having me.
And joining us here in the studio is Susan Globus, founder of Little Oaks, which is a resource center for parents of neurodivergent kids, offering guidance, support, and connection for families navigating these unique challenges. So, Susan, welcome.
Thank you so much for having me.
Yes.
So excited to be here.
Absolutely. Susan, I'd love for you first to tell us a little bit about Little Oaks and kind of what inspired you.
Little Oaks was sort of bred out of what I felt was real necessity. My first pregnancy was 2020. So right when COVID hit, found out a week prior to lockdown that I was pregnant. And so it was an experience, but a little bit of an opportunity because I got to stay home with my newborn child and really watch him develop and grow. And pretty early on, I saw that there were some developmental differences. And we didn't really know what that meant. So I spoke to my pediatrician, I spoke to whomever I had to speak to. Everyone sort of poo-pooed any real concerns that I had and said essentially, oh, it's probably ADHD. You know, let's just power through and we'll figure this out. When I realized that he wasn't speaking, I tried to get a diagnosis through the city and they never responded.
Yeah.
Panicked. I went private, got tested, and came out autistic. And when that panic set in with the diagnosis, because I really had no idea what autism really meant, they basically said, because he's non-speaking, there's really nothing that we can do. We can sort of guide you to a couple of resources, but, good luck, and sent me on my way. I started shaking. I really panicked. I thought immediately of what we all think about when we think of autism, which is sort of the worst case scenario. Is my child ever going to speak? Is my child ever going to, be able to connect with anyone, drive a car, have a girlfriend, have a job? So I started getting him services. I was also pregnant again around the same time. So that was sort of throwing a wrench into it. Mommy brain is real.
And I'm in the other end of it. I'm like, I have no brain. So
none, it's gone. So doing simple things like filling out paperwork seemed virtually impossible, keeping track of schedules, trying to figure out, Do I send to Early Start Denver model for, therapies? Do I do OT? Do I do PT? Do I do speech therapy? And which do I do first? Or do I do them all together? Do I overwhelm? And does that overwhelm make a difference? And me spinning really made my kids spin. I like to call this emotional telepathy that these kids have. And they really do feed off of you. And they feed off your nervous system. There's nervous system mimicking. So finally, when I sort of tried to relax and sit down and figure this out, I realized that the first thing I really needed to do was I really needed to learn how to regulate my own nervous system. And in order to do that, there were a couple of things that I did, and there are a couple of holistic things. I went to a therapist, and in therapy, I sort of had this conversation with my therapist where I was like, why isn't there help? Why do I not have a village? Why is no one helping me fill out paperwork? Why? And sort of immediately after, went to lunch with a really old friend who I've known since I was 12, and we started talking about it. And she was like, if you're really serious about getting this together and sort of making a hub or a community center where people can really get this kind of help based on your past experience, I have someone that can help you with that. And that's sort of where all of this kind of was bred from.
Got it. So Little Oaks really developed from personal experience and needing and wanting those resources. That's incredible. Dr. Mo, I'd love to touch on things with you a little bit and kind of back up to maybe explaining what neurodivergence is, or, a parent that's new to the term, which I think we all three of us are pretty well versed. I know it can sound like a really big, scary, broken word, and it's definitely not.
Absolutely. I really like the term. It took a lot of work from a lot of dedicated people to reach this term. And the idea is that it's a normal variant that happens naturally. We are not born in one structure in one way. However, for the sake of efficiency, we've created a world where things are done a certain way to conform, to produce better results. And for the longest time, we would think kids who would not fit directly in it have a weakness or have a disability. The truth is, they're just, the way their brain was created and developed is just different. So the way they process things is different. Under that umbrella, you have things like ADHD, which means that when some thought reminds them of another thought, inside or outside, they follow it. Attention is not a tool where they can divert wherever they want to. Whatever actually is interesting, they follow. You have autism spectrum disorders, which come with a bit of difficulties understanding the mindset of others and communicating your own thoughts in a way they will understand it. And other things labeled learning difficulties or challenges or differences, more appropriate, like dyslexia, communication disorders, emotional disabilities. The word disability is tricky. The truth is it's just a different ability. And the same thing that can be a challenge is also a strength. A kid who's very emotionally sensitive, when put in an environment that does not accommodate that, will have challenges. At the same time, they're much more empathic. They're able to tell what's going on with less explanation. A kid who has a hard time following what people are telling them to follow will also find very different ways of solving problems, of being ultra creative. These things come hand in hand. So it is important to call it a neurodivergent phenomena rather than a disability. And I'm very happy for Susan, the way it happened. I have two neurodivergent kids myself as well, and I changed my field of study. I was a pediatrician, and you'd expect to know, and I just like how she said that as a parent, you're put in a spot where you're supposed to do a great job without anyway being told what to do exactly. Then you have a kid who has special abilities and special needs, and you're put in a spot that can be very stressful, and you start to want to make it, you just want it to happen the way you imagine it. And it does not. I always many times tell parents, because I teach about newborn behavior and attachment, and tell them if they remember the last part of the Incredibles movie where the mom was falling from the helicopter holding her kid, and she's like, look at me, everything is fine. Don't worry about what's happening in the background. I'm here, I'm stable, you're good. And it's true what you said. If mom, who's a superhero, is anxious, it means something is not okay. And for parents to have the opportunity to learn very early on what is actually scientifically going on and what to do best, far from these tidbit bite-sized information that kind of group all parents and kids in the same category, is very, very helpful for sure.
That's so helpful. You've broken it down in a way that I've actually never heard anyone break it down. It's so easy to understand that way. I love the Incredibles analogy. Susan, what does neurodivergence mean to you as a parent?
So I think because no one really explained it to me, it took me a long time to wrap my head around it. And I first started doing things like reading case studies. And I was like, oh, should I take a class? And nothing sort of gelled until I started watching videos at 4:00 in the morning of other people's neurodivergent kids and finding little connections, small connections. The truth is that every kid is different. Mm-hmm. You're never going to find a one-size-fits-all model. And I think when someone explained it to me, when you're a newborn, you have all of these synapses firing at once, and they're life-preserving. And as as our bodies realize we don't need certain connections, certain synapses, we prune, we slough them off, and neurodivergence doesn't. When I realized that that's really what it is, I was like, oh, well, then we have to open the Xavier School like tomorrow, right? Because really, it's a superpower.
Right.
You have more going on, not less. It's not a deficiency,
right,
by any means. So how do we hone that? How do we hone this incredible ability that you have, and make you feel comfortable enough to be the superpower that you are, right?
Right. And I think one of the things too, that Dr. Mo mentioned in his discussion as well is that, autism is a spectrum disorder, and there's degrees, and there is the ability for them to gain in those areas. I have several friends with adult nonverbal autistic children who also really struggled finding schooling, finding support, particularly if they are nonverbal and might have some physical outbursts and tendencies. And I know as parents, it's a real struggle. And it's like, well, what do I do and where do I turn? So I love that Little Oaks really came out of that, because you have not only the personal experience, but also that desire to learn and to educate and to help other parents. Dr. Mo, I'd love to hear, is there like a connection between like genetic neurodivergence, or is it just environment? How does that play, and how can maybe a parent who is realizing that they too might have ADHD, some neurodivergence issues, ASD, how can they help facilitate and learn about themselves and their kids?
So for being on the spectrum, we hear a lot about the increasing rate of prevalence, and the prevalence of the spectrum we're seeing more of is the high functioning, which does run in families. There are, let's say, about 150 genes that facilitate social interactions. For example, making eye contact when you're looked at, smiling when someone smiles and reflecting that. And sometimes parents have less of them. They have more of genes about focus, of course. And kids carry some of those. With ADHD as well, it's the only thing more inherited than ADHD in families is height, believe it or not. So it's that genetic.
Yeah, I know executive functioning disorder is it's like the hallmark of having ADHD, which means that it's really hard to manage your time and to make phone calls and to organize materials. So, it can make it really difficult as a parent to try and navigate those things for your child while you're also struggling with some of the repercussions of having a brain that works a little bit differently.
It can be very healing when they recognize finally that what they went through and was not recognized is now being recognized. Not only do they improve, but they also heal. And that points to the importance of what Susan mentioned of just understanding that now your journey with parenting is different. It's you and your kid both together, not the world outside. And it goes both ways, very healing for both.
Do you find that neurodivergence and substance use kind of go hand in hand? I mean, I know as someone with ADHD, it sometimes is hard to connect with, not hard to connect, but hard to
foster connection.
Hard to foster connection. I forget to call friends. I'll forget to call my family. My mom will be like, why don't you think of me? And you're like, it's been 3 weeks. I didn't even notice.
I think of you all the time. I just didn't think to call you.
I didn't, or like I go, I should call. And then it goes away. And, I think that really, I know for a long time, I beat myself up about, I don't know how to be a good friend. I don't know how to connect with people. And I think a lot of times we maybe think that, autism or ASD diagnosis is the thing that's going to prevent kids from learning, from connecting with each other. But sometimes it can be the kid who interrupts everybody and who doesn't know how to sit still and who does all that can also make connection really hard and make the other kids kind of shun them and go like, you're weird. Why are you weird?
Right. Or the opposite, which is you overcompensate so much that you're sort of now put yourself in a position to be the life of the party and to be on all the time. And that is exhausting.
The masking and the
performative, of all of it. It's hard.
Yeah.
Dr. Mo, what is the relationship between neurodivergence and substance use?
A couple of them. First of all, we know from data that neurodivergent kids have higher rates of anxiety, depression, which are things known to lead them to want to regulate by self-medicating. Another point to think of is that kids fortunately are programmed to succeed. And in our society, that means education at school. And of course, for kids, especially as they approach 11, 12, 13, the age of risk, it's peer connections. When we can do these things well, we get this dopamine reward that makes us want to do it more. When you start with a kid who is having a hard time achieving these milestones of success, it means they're having less of the dopamine come back to them. So society is not regulating them and helping them co-regulate and feel successful. So you have that dopamine a need to feel that you're doing something okay and succeeding at it. That's the one thing. Not being part of the mainstream, not finding it enough. Kids go to school and they find school very rewarding. They find socializing very rewarding. For kids who have challenges with that, it just is not. And you just naturally isolate, exactly like you said, with ADHD, with disabilities, with autism spectrum disorders. You have less of that connection, you less appreciation for that connection. And absolutely now we know for some people call the opposite of addiction is connection. So for sure.
Knowing that there is this risk association with neurodivergence and substance use can be pretty scary for parents. I think something that's really exciting is to know that when young people are getting access to adequate treatment for their ADHD, for their autism spectrum disorder, et cetera, that their risk of substance use significantly decreases. Is that right, Dr. Mo?
Absolutely. Thank you so much for mentioning it. I get that all the time in the clinic with parents. And it's also the myth adds into it. They say, well, we have a relative who has ADHD and they start them on meds and now they develop addiction disorders and overdose. Now we're afraid to do the same. You dig a little bit deeper and it's actually because they were not treated well. Actually, they're self-treating. There's a very strong connection between treating ADHD and decreasing the risk for use disorders, failure at school, social kind of difficulties, 100%.
Welcome back to Awkward Conversations and welcome to Season 5.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
You're listening to Awkward Conversations. Thanks for being here. I know something that occurs with children with ASD diagnosis and adults is that sometimes the inability to read social interactions and social cues can sometimes make them more at risk for being taken advantage of, being abused, things that maybe a kid who was like, this doesn't feel right, or this feels a little funny, a kid that maybe has difficulty discerning some of those things. Does that put them at a higher risk for being susceptible to some of those things? And how, as a parent, do you keep an eye on that and make sure that they understand, how to differentiate good people, bad people? Something we have to talk to our kids about anyway.
From our experience in the field of addiction, we know it for a fact that they are targeted more and they misinterpret that kind of wanting to connect with them with a smile as friendliness. They also are very happy that someone wants to spend time with them and use a substance. So they find that as a true connection that they really enjoy and they prioritize because they really want that connection so bad that they prioritize it so much.
I think it's knowing your child is going back to knowing your child and knowing that like there are some potential concerns here, but this isn't because your child is neurodivergent doesn't mean they will absolutely use substances.
Right.
But there are some risks to be aware of.
Right. And I also think that the idea of, you were talking about proper treatment. There's a range and a spectrum of how to address that neurodivergence from so many different angles, whether it be medication or therapy, play therapy, connection, occupational therapy, speech therapy, all these sorts of things. Right. And, there's so many things that I think, if parents are really hesitant or reticent, or they think their child might be too young, that there are ways to start building those things around them, those protective factors. What do you find are some of those protective factors that parents can kind of maybe put into place that might not necessarily be medication focused, but what have you found in your resources?
I'll be honest. I feel like my kids are very young. So my kids are 2 and 4. And I feel like because they're so young, my kids have all of the therapies. They have speech therapy, they have OT, they have PT, they have early start Dever model, which is a form of ABA. And they've had it for a long time. So I caught this early. And the thing that really made the difference was, number one, every time they had a meltdown, I reminded myself that meltdown was them asking for help. And it sort of drew me back and it allowed me to let them have their moment, let them have their time. And at this point in time for both my kids, I am their medication. And in terms of therapies, they're incredible, first of all, and they make an enormous difference. But they don't make a difference unless your kid is ready and willing to accept that help.
Right.
And I think when your kid sort of doesn't trust the world around them, which to me makes a lot of sense. They shouldn't trust the world, the world around them. Before they really learn to trust you fully, there's very little difference that can be made. You really need to be their pillar.
Right.
And then once you are, and accept them for exactly who they are, saying to yourself, if they never speak, they know how to communicate with me. They know how to. My kid, I love it is cute aggression, okay? I just want to, I think they're amazing. I think they're the coolest, smartest, funniest kids in the universe. And I stopped focusing on the milestones that they were missing, and I started letting them lead, and I started not putting them in a box, and I started just, whatever happens, happens. They're dope on their own. And for me, that's what really made a difference. And I'm sure in a couple of years that will change and I will hate them. No.
Wait till they're teenagers. 15, 17, let me tell you.
Just cruising for a percent. No, and I'm sure that will change. And I am open to things like medication.
Dr. Mo, what might you say to parents who are trying to decide if medication is the route that they want to take for their child?
I'm going to first start by just commenting on something that Susan said, which is very nice and very accurate when she said, I am their medication. The connection that you form with your parents is the first connection that determines future relationships. Kids do want to see their parents proud and happy with them and, throwing back to them their success. You'll be surprised. Your kids might do fantastic as teenagers. Knowing exactly what neurodivergence they have and the environment they're in will help guide you down the road for services. For Autism Spectrum Disorder, Susan can talk much more than me about that, but there are a lot of services you can get once you have the diagnosis, and it's the known ABA, which really in a way is old school parenting, like look at my eyes, shake hands, good job, which we don't do as much. And that I have to say, when it comes to medications, I can share my personal experience. I have 2 kids who have ADHD. And I myself have ADHD. It was not treated until much later in life. My older kid, again, very smart, of course, very creative, couldn't read, and he was in 3rd grade. And I had the best IEP going on for him, spending time with him. My wife happened to also be an addiction psychiatrist, and she comes from a European background, and she was opposed to medications. I was pro, she was against. She went to many lectures and talks about it. Eventually, we started him on medication for ADHD when he was about 8.5 or 9. And he now refuses to get less than an A in anything. And that's the same kid. So my recommendations for medications as an option for ADHD are very solid. as part, of course, of other supports. Again, going back to Susan, when they don't trust the world around them, but they trust you, there's a lot you can do where they will listen to you. You start the conversation about substance use early on in life when they still have that very strong bond with you before they even hit teenagehood. When I get older kids who do not want to take medications, I, of course, explore that with curiosity with them. But what I do a lot is I actually share what I think their experience with ADHD looks like. And I just tell them, just wondering, do you feel when you go to the classroom that you have no idea what's going on all the time? Other kids who are not as smart as you know what to do. They know what the homework is. They know what others are talking about, but you don't. And it's very frustrating and you think it's a deficit. And I get them to really get that shame seen and resolved. And then I tell them, well, these meds really do help. So that trust again.
Shame, of course, is such a contributing factor to substance use. And shame contributes to that isolation kind of impact. And so I love that you have those conversations with young people to try to, just get that out on the table if that's there and be able to try to clear the air and heal those wounds, that they may be experiencing.
And also, the shame stigma around medication and having those open conversations because, studies have shown that kids who are neurodivergent, who maybe, don't have access to meds or aren't being treated, and that could be something that's really useful to them, they do have higher rates of substance use and misuse because they're looking to self-medicate. I know I experienced that, and it's not something that I learned until much later. I was like, oh yeah, that's why I always went for those because my brain felt better.
I like to refer, when I have this conversation with parents, I like to let them know that this is one of the oldest medications we have in America. We have kids we've been following for 50 years. And we've seen, other than, for example, a possible half an inch shorter at 20 years of age, which could be related to not eating as much, everything improves. Their social functioning, their confidence, risk of substance use decreases tremendously. Much more important, they're much more likely to listen to the doctors talking about it with them, listen to their parents.
Some of the folks that I grew up with, I think, feel like maybe they were over medicated or the medications kind of didn't work for them. Are there shifts from kind of 20, 30 years ago in terms of what, how those medications are being used and at what levels versus now and the types of medications available to treat, ADHD today?
I have so many parents who have that specific attitude where they say, well, we know somebody who used the medications and it was bad for them socially. So I actually opened the conversation with, and it's very important not to over-medicate because that was done a lot in the 80s and we end up with too much breaks on the head and a state of what's almost like zombification, which parents have in their minds. So I just address that and put it on the table before they even have to talk about it. The goal is there should be no change in the personality, just improvement, and you will feel your kid is being more themselves.
And working with you and with our colleagues, I see that there are non-stimulant based medications. There's, multiple now classes of kind of even stimulant based or different types of stimulant medication. So, it used to be kind of like Ritalin or bust.
Right.
I feel like now the options for providers to kind of tailor the experience for a young person. If one isn't working, maybe there's another one that works better. Those opportunities are a little bit greater now than they were, certainly when I was growing up.
And I would also say that, a difference in what we grew up with, even 30 years ago is that we are now understanding and diagnosing girls with ADHD, Autism Spectrum Disorder, Neurodivergence, because it can show up really differently in girls than it does in boys, which is why I think a lot of moms have gotten to their 40s and then been like, oh my gosh, I totally know why my kid has ADHD because so do I. And I think as women and as moms, we're kind of told like, oh, you must just think you do, or is it really, is there a big difference in how it presents in boys and girls, and should that be something that parents maybe take into account?
We've learned actually that ADHD is much more diagnosed in boys than in girls because girls have more ADD, where they're just inattentive, then less hyperactive, and they're just quiet, which is expected and promoted, unfortunately, and they're much more also able socially to fit into expectations and hide it well. Yes, and we're finding it now, it's maybe double what we thought, but it still keeps on growing. The other category of individuals where we're diagnosing ADHD more are adults for the same reason, because the hyperactivity reduces, but the inattention is still there.
Yeah, I know my thing was always you can't stop talking.
Right.
And I know a lot of girls in class, it was like name on the board.
I just say my as president, my name was on the board
My mom
every
was
week
like,
in first
"What
grade.
and I was like, it's a physical, like I didn't understand at the time, but I was like, I can't stop.
Highly
It just comes
adaptable
out.
people pleasers.
Yes.
It is, right. And you're so on and you're so expected to be on. Social lubrication is a huge part of the teenage experience in general and a part of neurodiversity and how we feel like we can connect with other people. And you decide you do things like you can go out with your friends and you can do drugs and you can drink. And in the moment, you feel better. And then the next day, feel an incredible amount of discomfort and shame because you don't know what was said and you don't know what was done. And you don't really know how you came off to everyone. And that sort of leads into, well, now I want to forget that. And it turns into that vicious cycle of now I'm sort of a teenage drunk, or now everyone sort of sees me.
It's one more label, almost.
It's another label on something that you're just really trying to get rid of your initial stigma, and it's adding more.
And it's not a long-term solution to what you're talking about. The reason for the initiation of the substance use, it doesn't really help. It just creates more challenge.
Right. And impulsivity is such a hallmark of neurodivergence, particularly ADHD. In the moment, I want it, I do it, it's fun, and then the consequences catch up later. Right. And that's something that teenagers are anyway. And so it's like adding that just really cranks up the volume of like, I just did the stupidest thing and I just didn't even think about it. And you don't. You go, oh my gosh, what did I do?
And from that you go into like exactly like this need for, so give them what they need with preemptively help them understand, like a kid who is on the spectrum has that need for socializing and connecting, and provide them with the opportunity to do so before they have to resort to these extreme measures. The kids who need to be able to pay attention and do well, show them their strengths, celebrate their successes with them continuously, where they don't have to reach that point where it's an all or none event. Also, this drive for, it's very interesting the way you said it, it's really hit the spot on reward-based behavior versus goal-based behavior. Reward-based behavior being just chasing that dopamine, what feels good right now, which in itself, nothing will defeat drugs in terms of giving you that dopamine. Versus goal-oriented, where the reward comes after you achieve your goal, but it's harder with executive function difficulties when your goal is socializing and you don't know how to. And then the parenting comes in to help them delay gratification. Of course, tell them when you finish your work, you can get that video game time, or you can get that, extra reward.
But neurodivergence can also show up as the kid that is like, I am not wearing that shirt and I'm not putting it on and it feels funny and I don't, and you're like, you've got to get in the car. You've got to get in the car. I need you to get in the car. And it feels so frustrating. And oftentimes those are the moments when we lose it as parents, the kids lose it. It feels like they're just being obstinate. And I think getting parents to understand that lack or that struggle with emotional regulation can lead to, I'm digging my heels in because I just can't manage anything other than this.
Yeah. I so loved what you said, Susan, about, seeing when your child's having that difficulty, reframing that and recognizing that is like them asking for help.
Right.
I have a sibling who lives with autism, and I remember being a fourth grader and him being at the kindergarten door and getting off the bus and him having a total kind of like meltdown over he could not get in the school building. And I remember his kindergarten teacher just walking away and me being like, I'm in fourth grade. Like, what am I doing?
Transitions. It's the transition time. We suck at transitions,
Right.
If your kid is like really struggling to get home or to get to school, like those are things to think about.
There's also a lot of self-direction. Kids that are on the spectrum have a lot of self-direction, and they have that self-direction because everything in their body is screaming at them, telling them this is what they need to do. Why am I listening to you when my body is telling me what I need?
This is how it is. Right.
And I, as a parent of young kids, remember, so things aren't as important to get them to school, to, get them in the car, to strap them in. Really? Yeah. So what I sort of figured out was a little bit of, why does this matter?
Right.
Why am I
that all the time.
triggered? Right. Why am I so triggered in this moment?
Right.
Who cares if he's a little late to school? He's 4.
Right.
Who cares if he doesn't want to immediately get into his car seat? Who cares if he doesn't want to eat at exactly 6 o'clock?
Right.
Why am I so upset about it?
Right.
And if I stop forcing it, what is what's going to happen.
Right.
Let me just see what happens. Let's see what my kid does.
Well, and you kind of mentioned, I was going to say just with the scaffolding that we were talking, you mentioned rather than being that rigid force of like, sort of a monolith holding everything together in concrete, it's a little more like, hey, I'm going to just kind of keep the building safe and you figure out where things need to go.
Right. And that doesn't mean that you can't discipline them in certain ways. And that doesn't mean that they don't need routine, because they absolutely do. It's just, is there much of a difference between 7 o'clock bedtime and 7:10? Is there that big of a difference between brushing your teeth for 20 seconds or 25 seconds or a minute? Where do you draw the line? And it's difficult to sort of figure that out.
I think that's a parenting thing, no matter how old they are. My kids are teenagers, and I'm like, is this the battle I want to pick?
I think the truth is that a lot of this, almost all of this, is every kid experiences all of this. So I think that even though, yes, this is geared towards neurodivergence, I don't think that any kid wouldn't benefit from all of these things we're talking about, from all the services that neurodivergent kids get. I think it's really helpful.
In my experience working with families with young people living with autism too, some of the conversations we've had, are about, I really want my kid to be able to like go to the circus or the amusement park or certain places. And there's this conversation to be had around like why? Because you maybe it's your childhood, you're thinking, I loved the circus or I loved the amusement park and I want my child to have that experience. And for some kids who, are living with autism or, that's like a nightmare for them to go to
an overstimulating nightmare.
It's also a nightmare for you as a parent.
Right,
to
get
nightmare.
them in that situation. And to be able to practice that can be helpful, but also sometimes to be able to say, maybe the amusement park isn't the thing that we're going to focus on to give you joy, to give you goodness. What is the thing that will bring you joy and goodness?
I wanted to ask Dr. Mo, because you had said this too about kind of, and we talked about like that parental shift in kind of dropping the timelines, dropping the don't be so stressed about the developmental milestones. Dr. Mo, I'd love for you to speak to that, because I know that, we all read the what to expect when you're expecting, what to expect when they're, 5 or whatever. And we all are like between 8 months and 13 months, they need to be talking. Between 15 months and how do parents, maybe give themselves a little bit of wiggle room, feel confident in, asking their pediatrician, hey, they might be a little bit behind. Is it okay? Should I stress? Should I worry?
Definitely the bite-sized piece of information is everywhere. And like these magazines and these books want you to think that the parents who read them have it together. But it's just such a dangerous thing to give bite-sized piece of information. You want to set them up for success is kind of the bottom line of how I see it when it comes to, like Amy was saying, you go to a party and you want to leave and you have a certain time. You have a kid who just can't quickly switch. And that's just the chemical in their mind where they switch from one thing to another. It just takes longer time to shut down one chemical river and move to another. And it's very normal to say, stop playing video games, and they explode with anger because they weren't expecting it. And you respond to, oh my gosh, my kid can't control their anger. So some things you can do is just remember your kid and you are different than anybody else. You can give them a timer where you say 5 minutes, 1 minute, now we're stopping. Learning how to empathize with their feelings, however, draw a line in how they express them is also a good way of empathizing, keeping that balance. Absolutely, talking to a specialist early on is very useful. They can, for example, not talking on time. They have up to 1.5 the time. Instead of at 1 year, if they walk at 1.5 years, they're still fine. Sometimes kids walk when they're 2 years, but they progress very quickly. They're fine. I think we're all kind of neurodivergent.
I think neurodivergent
here for sure.
Right. I think neurodivergence is the normal, and it's just a gradation of where your brain falls on that.
And how stressful it is to fit in. Like, it is stressful to all of us, but to different levels. And how much stress can we tolerate? So yes, absolutely. Setting them up for success by predicting, knowing them well early on, understanding them. And then, like Susan said, with the scaffolding, it's just really priceless information.
What I'm thinking most at the end of this episode today is that, again, neurodivergence can be such a superpower, and that it doesn't have to limit or define your child's success. Mm-mm. However what your hopes are for them, whatever their hopes are for themselves, people who are neurodivergent live highly successful, highly fulfilled lives. And that is evidenced by this panel here today. You are in good company if you're a neurodivergent.
Right.
I'm in good company if you're neurodivergent. And again, it doesn't have to be a life sentence. It doesn't have to be something that holds you back from, achieving all that you hope to achieve.
Right. And also that, for parents, if you're one of the people who is getting a late diagnosis, that's okay too, because now you're figuring it out for yourself as well. And, it's a journey, not a destination for sure. And, I just any final thoughts, Susan, that you would love to leave our parents with?
Yeah, I think that the truth is that we put our kids in a box, and our milestone timeline is so rigid, and it gives us anxiety. It gives everyone anxiety for that matter. And that we need to remember that neurodivergence is not the same as neurotypical.
Right.
Okay, the minds are different and their timeline is different.
Mm-hmm.
In other cultures, autism is actually translated as in their own time.
Yeah.
And if you give them that time,
Right.
anything is possible.
Right. Yeah, it's really important to take that stress off of you and your kids, because everyone will feel it. Dr. Mo, any final thoughts from you that you really want to leave parents with if they're going through this on their own?
One thought is we do focus a lot on the development of their walking and their talking and their school and their learning, and we forget about emotional safety at home being the hugest, one of the biggest things, that they feel that they can emotionally express things. They are not going to get traumatized at their home, that they are safe, they can communicate. And for the parents to achieve that, it means they have connected with their kids and make them feel safe, and then they can actually monitor them growing older.
So again, back to that connection and communication between families, between caregivers and the pediatricians, and resources, and amazing resources like Little Oaks that you have. Thank you both so much for joining us today. This has been a really great conversation. As someone who is in this club and has kids in the club, and we're all trying to figure it out together, I think it's just a really important conversation for us to have, to continue finding that acceptance and really what it means to, we're all in our own time.
Celebrate it.
Yeah, absolutely. Well, Susan, where can people find information about Little Oaks or resources?
Yeah, so we're currently in our fundraising stage.
Great.
But our website is www.littleoakcenter.org. And I think that in terms of, we did want to build a brick and mortar. It was important because we do feel that socialization is incredibly important. But we are also developing a full online resource hub with comprehensive videos, things like links to how to apply for services, where to apply for services, attorneys in your city that you can help you sue the city if you've decided to pay for your own services. We're just sort of trying to get that together to make our reach further.
Great. And we will have a link for Little Oak Center in our show notes. Dr. Mo, is there anywhere that people can find any resources that you would recommend?
For autism, there's a website called Autism Speaks that is very helpful. There are many places where kids who are on the higher functioning levels. There are also a lot of fantastic government websites and resources for addiction, for divergence. We are very happy to be like a resource for all sorts of addiction in kids up to the age of 21. You can just go to the Boston Children's Hospital ASAP program. It's a whole collaborative of people like Amy and other educators. We can provide lectures when needed to groups. We can connect them to even social workers and therapists who can work with their providers. We try our best to fulfill every kind of need that's thrown at us, for sure. We enjoy it a lot too. So thank you everybody for having me. It was wonderful to be part of this show. Thank you. Thank you, Amy. And I do have to thank Dr. Sharon Levy for all the work she's put in that I benefited from in learning all these details. Thank you, everybody. Take care.
Great. Well, thank you so much. This is, again, just such a great conversation, and we really appreciate it. And all of those resources will be in our show notes for our listeners and our viewers. We really appreciate you coming and joining us for this really important talk. And until next time, we'll see you next week. Keep those conversations happening. That's it for today's episode of Awkward Conversations. I'm Jodie Sweetin. I'll see you next time. We're talking practical strategies for fostering resilience and happiness in our families. So get ready to transform those grumpy mornings into moments of joy and strength, all the while equipping our kids to face challenges without turning to substances.
Positive emotions, engagement, meaning and purpose, positive relationships, and accomplishment. So when we can hit on all of those things, that's what it takes for us to flourish and to thrive. That's one of the fundamental theories of positive psychology.
What are some of the ways that you've found where you've been able to say, I understand you might not be able to give everything, but here's what you can do?
It's the small daily activities that add up and they compound to create big results over time. It's better to do something for 10 minutes a day or 5 minutes a day that feels good for you. Practice a tool or do a meditation for 5 minutes. Go out for a walk for 10 minutes. Rather than trying to do a 2-hour practice that just isn't practical every single day. When we're taught to focus not just on the outcome, but we actually focus on the process and the journey along the way, we're able to enjoy it so much more and experience greater sense of well-being as well.
Make sure to check out GetSmartAboutDrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.